If the word OSCE makes your stomach flip, honestly, you're not the only one. It doesn't matter whether you're in first year, second year, or heading towards your final sign-off. OSCEs are one of the most anxiety-provoking assessments in nursing. And most of the time, it's not because student nurses don't know enough, it's because you're not really sure what examiners actually mark. Hello, you're on Shift with Sean, the platform that empowers student nurses with the knowledge, the tools and the support to build confidence in practice. Now, in this video, I want to break down OSCE marking criteria in plain English, explain what's really going on behind that clipboard and give you some realistic advice you can actually use. So whether it's your first OSCE or your final one. Stay tuned to find out where you can download your free OSCE checklist that I've created to help you prepare for these exams. First things first, an OSCE is not designed to trick you or catch you out. Now, OSCE stands for Objective Structured Clinical Examination, and this means that everyone's marked against the same criteria. Each station follows a set format, and it's about practical nursing skills and decision making, and yes, it's assessed. You get marks for each station, but most universities set a pass mark and record the outcome as a pass or a fail. OSCEs are usually held in clinical skills labs or mock wards at your university. You'll either have a mannequin or a volunteer acting as a real patient for you. Each station focuses on one specific skill or scenario, and then you rotate round them. It's a little bit like a circuit training at the gym. Each station usually has 5 to 10 minutes and then you move on. Now, what examiners are actually assessing comes down to the core things, and that is, can you deliver safe patient care? Can you follow professional standards under pressure? And can you explain what you are doing and why? At this point, you are not expected to be like an actual registered nurse. Now, most OSCE marking criteria are laid out as checklists, and they usually include sections like preparation and environment, communication, infection prevention and control, clinical skills steps, safety checks, documentation and verbal rationale, and professional behaviour. Now, within those sections, there are normally two types of criteria: essential criteria, and these are the must-pass ones, and they're usually safety related. And then you've got desirable criteria, and these add marks, but they won't fail you on their own. And now, you do not need to get 100% to pass an OSCE, but you will need to consistently hit those safety critical elements. Safety comes before speed. A lot of students rush because they think OSCEs are about being slick and fast, but they're not. Examiners would much rather see you pause and check something, verbalise a safety step, and calmly correct yourself. If you rush, you're far more likely to miss something basic. And those are the things that carry most weight. If you realise midway through that you've missed a step, you can say, I'm just going to pause and check patient identity before I continue. This shows situational awareness, not failure. Remember, nurses are human. You're allowed to mess up, recenter yourself, and carry on. Before we carry on, I just want to quickly share something that I have created for student nurses, because this is something that I wish I'd had when I started my training. It's my Nurse in Progress book series. Because who you are in year one is not the same person as you are in year two, and it's definitely not the person you are by the time you reach that final placement in year 3. And that is why I've created the Nurse in Progress book series. It's a 3-book series with 1 book for each year of your nursing degree, so you get the right support at the right stage that you're actually in. Inside each book, you'll find placement confident tips, realistic study strategies that fit around your shifts, honest personal stories from someone who's been there, and a real insight into what nursing is truly like. This series does not sugarcoat nursing. It shows the reality, the stress, the pressures and the self-doubt, but also how to survive it and grow through it and feel more confident in yourself as a nurse. I'll leave the link for this series in the description. It is available on Amazon right now. OSCEs are one of the very few assessments where talking to yourself is encouraged, and that's because examiners can only mark what they see, hear, or are explicitly told. If you are silently checking allergies, consent, or observations, they may not count. It helps to pretend you've got a student or somebody else with you. It makes it less awkward than talking to yourself. But simple phrases make a huge difference. So things like, I'm checking allergies to ensure that this is safe, or I'm maintaining aseptic technique here to reduce the risk of infection, or I would escalate these findings according to the local policy. These are where your concrete marks are. Communication is not a soft skill. Communication is often a standalone marking criteria in OSCEs. Now, examiners are looking for clear instructions, consent, simple explanations, reassurance, and a respectful tone. Even if you're working with a mannequin, you still need to speak to it as if it's a real patient. Now, skipping communication is one of the easiest ways to lose marks in OSCEs, especially in your first year. And realistically, if you can't communicate with patients, you can't gain consent, build trust, or assess them properly. If communication doesn't come naturally to you, the only fix is to do more of it. So when you're on placement, make small talk with patients, purposely speak to them, and slowly build your confidence. It is a skill, and skills can be practiced. Infection control errors are common fail points. Infection prevention and control is a big one. Common OSCE mistakes include forgetting the 5 moments of hand hygiene, touching non-sterile surfaces mid-procedure, not cleaning equipment after use, poor glove removal, or missing PPE. Now, examiners don't expect perfection, but they do expect awareness. If you contaminate something, say it and correct it. If you put your gloves on before washing your hands, just acknowledge it, remove them, and then wash your hands. If you realise early enough, there's no harm done, and you will often still get the marks. Professional behaviour is always being marked. Now, even when it's not written on the checklist, examiners are still watching how you manage your nerves, how you respond to prompts, how you correct mistakes, and how you talk to patients and colleagues. Panicking or going blank doesn't automatically fail you. It's only when that anxiety leads to unsafe practice that you're in trouble, and this is why preparation isn't just about knowing that skill. It's about knowing your triggers and practicing those grounding techniques so that anxiety doesn't take over. One of the biggest mistakes is trying to memorise a script. OSCEs aren't about robotic performances. If you forget one line, everything will fall apart. So instead, focus on the principles. Get your opening introduction right. Focus on your safety, your consent, infection control, and your communication. Another big one is not reading the station brief properly. So before you start, always check the patient details, the aim of the scenario, what equipment is provided, and what you are actually expected to do. Use the full reading time because it's part of your assessment. And finally, freezing after a mistake. Mistakes happen, emotions are high, and that is normal. What examiners want to see is recognition, correction, and reflection, because that is real nursing. So practical OSCE prep then that actually works. Practice out loud, not silently. Use the marking criteria as a revision checklist, and practice explaining why you're doing things, not just doing them. Record yourself and watch it back, and rehearse how you'll recover from errors. Confidence often comes with knowing what to do when things go wrong. If you found this helpful, please click like and subscribe because it helps my channel help more student nurses. Don't forget to download your free OSCE checklist from my website. The link I'll put into the bio. Be kind to yourself. We've got this.